morning. Welcome to RedTape Healthcare. My name's Kurt Preuss. Today's episode, we're going to talk about where you can save yourself money. And one of the areas that most people get confused is with emergency services, urgent care services, and preventive care. So today, let's talk a little bit about where or when you need to have emergency care. What conditions have to occur. Typically, it's for chest pain, head injuries, possible stroke, severe bleeding, sudden difficulty breathing, and major accident or trauma. That's typically what most insurance companies look at as when emergency care should be facilitated. So again, emergency care should be looked at for when there's chest pain, head injuries, possible stroke, severe bleeding, sudden difficulty breathing, major accident, or a trauma. Now, the next question that comes up is, okay, what about other things that aren't emergency? Well, let's talk about that for a little bit. When you would go to an immediate care or an urgent care facility, and typically they recommend, meaning insurance companies typically recommend that you go there for if you have a cough, cold, sore throat, a minor burn, mild allergic reaction, fever, flu, earache, or a sprain or a strain. These are just some of the things that where you can consider an urgent care and immediate care. And the reason you want to look at that, it's less expensive for you out of pocket. I'm not trying to deter you to go to a hospital. However, from a financial point of view and maybe even for a quicker service, if you encounter a cough, cold, sore throat, minor burn, a mild allergic reaction, fever, flu, an earache, sprain or strain, it may be in your best interest for care and financially to look at an immediate care or urgent care facility. Now, the other areas part of the Affordable Care Act, which is included in that, are preventive care services. These preventive care services typically include well visits, annual checkups, recommended for vaccines and flu shots, screenings for high blood pressure, high cholesterol, diabetes, alcohol abuse and tobacco abuse, services specifically for women and children, and also for cancer and other screenings. Now the question you have to ask is, okay, where do I go for those services? Typically you would either go to your primary care physician for the services, or the hospital may include those services. And typically the preventive care is included in all the health care plans by the Affordable Care Act. Continue to watch our educational series. Join me, Kurt Preuss, to learn techniques and strategies to help you save money and how to navigate our frustrating healthcare system. Remember, you do have control over your healthcare. Don't let the system wrap you in red tape. For more information or to subscribe, please visit